Hello everyone. Today I come with another morning motivator. So as he says, a 52-year-old male presents to his primary medical care with the complaints of back pain and increased fatigue for the past 6 months. And this past week, the back pain radiates to his leg, and it's described as stabbing in nature, and it is severe. That 7 out of 10 that he gave. There are no associated paresthesias, and he unintentionally lost about 4.5 kilo in the past 6 months. And he has not had any injuries or recent falls, and he has no history of medication intake. And the physical examination was normal. And on the laboratory evaluation on the CBC parameter, the hemoglobin is 10 gram per DL, and hematocrit is 30% mild anemia. MCV 80 femtoliter, and serum creatinine 1.5 milligram, and serum albumin 4.2 gram per deciliter, and serum calcium 11.2 milligram per deciliter. And peripheral morphology, it shows normostic normochromic cells, but some roulocs are seen. And the bone biopsy was done, and it shows increased plasma cells making up more than 50%. Okay, 50% of the total cell population. So, what is the diagnosis? So, let us clarify, or let us jot down important points from this question. So, for example, the first one, 52-year-old male. So, this is an elderly male patient. One. The chief complaint, it is lower back pain. Okay, the chief complaint is lower back pain and increased fatigue for the past 6 months. So back pain, lower back pain, okay, lower back pain, fatigue, okay, for the past 6 months. Yeah, and the back pain is radiating. That's why he's seeking the healthcare. And unintentional loss, weight loss. This is very important. High yield weight loss, unintentional weight loss in the past 6 months. Okay, this is another important. This is the second point. This is the third point. Okay, weight loss. Always weight loss ስናስብ unintentionally በፍጥነት መቀነስ ስናስብ we have to think of either malignancy, okay, cancer ማሰብ አለብን, or we have to think of some systemic illness, okay, some type of systemic illness ማለት ነው. Otherwise, no history of injuries or recent fall, no history of medication or intake. On the laboratory wise, CBC ተሰርቶለት ሄሞግሎቢኑ 10 gram per DL, hematocrit 30. So anemia ያለው, okay, this is mild anemia, normal. But it is its mean corpuscular volume 80 femtoliter means normocytic. Okay, normocytic. Normocytic. The size is normal range. And organ function test ላይ serum creatinine 1.5 ሚሊግራም ነው ጨምሯል። Okay, more than 1.1 or more than 1.2 ከሆነ that's elevated ማለት ነው። acutely ሊሆን ይችላል, chronically ሊሆን ይችላል. We have to measure it in a serial pattern. So this is elevated. So this is elevated. Serum creatinine, renal function derangement. Serum albumin, this is in a normal range. It's below 5 gram per DL. Serum calcium, it's 11.2. So it's elevated because the normal range ranges from 8.5 to 10.5 milligram per deciliter. This is very important. So this is one of the electrolyte that we have to always know, together with the sodium level, together with the potassium level. Okay, we have to always measure the calcium level. Okay, the range should be known. The range should be known. For the sodium, from 135 to 145. For the potassium, from 3.5 to 5.5. For the calcium, 8.5 to 10.5. Okay, so in this case it is 11.2. So there is hypercalcemia. So this is significantly elevated. It is hypercalcemia. So these are very important points. Okay, On the peripheral morphology, he has normostic normochromic cell, well, but there are rulox. What does rulox means? It is an aggregate of red blood cells. red blood ሴሎች ተጣብቀው ነው ያሉት። ኦኬ peripheral morphology ላይ ላብ ቴክኒሻኑ ሪፖርት ሲያደርግልኝ there is rulox. Okay, rulox. So that means there is some kinds of thing. So in this case, it could be protein that stick red blood cell together. Okay, a stick red blood cell. This is very, very indicative. It's important. Okay, this is important point. And the bone marrow, the bone biopsy shows increased plasma cells, making up more than 50% of total cell population. So this also means this is diagnostic anyways. This is diagnostic. ስለዚህ ቦን ማሮ ላይ ከ50% በላይ የሆኑ ሴል ፕላዝማ ሴልስ ናቸው። These are protein secreting, protein producing lymphocytes. Okay, B lymphocytes. So ከ50% በላይ ነው። Even ከ10% በላይ ራሱ ቢሆን this is diagnostic for multiple myeloma. It's diagnostic for multiple myeloma. So probably the diagnosis is MM or multiple myeloma. Okay, multiple myeloma. Thank you. Okay, let us proceed with the more clarification. So an elderly patient with lower back pain plus elevated serum protein. Okay, what are possible differential diagnoses? Number 1, multiple myeloma. 2, Waldenström macroglobulinemia. 3, MGS or monoclonal gammopathy of unknown significance. 4, metastatic bone disease, but they may not have elevated serum protein specifically, but they will present with lower back pain. So SPEP, it is an investigation of choice, okay, that can be done in a higher setup. So it is serum protein electrophoresis. በአጠቃላይ ያለውን ፕሮቲኖችን ነጥሎ ነው የሚያወጣው። የትኛው ስፔሲፊክ ፕሮቲኖችን ልክ እንደ ሰንትሪፊውጅ አድርጎ በደማችን ውስጥ የሚበዛውን የፕሮቲን መጠን ለይቶ የማውጣት የሚሰራ ማሽን ነው ኤሌክትሮፎረሲስ። So this is an investigation of choice to differentiate the above differentials. Plasmapheresis is a treatment of choice. Okay, it's a treatment of choice. Okay, for the above gammopathies. For the above gammopathies. So let us see one by one. This multiple myeloma, Waldenström macroglobulinemia, monoclonal gammopathy of unknown significance, they are collectively called monoclonal gammopathies. That means a specific immunoglobulin, one type of immunoglobulin is secreted at a time. So in case of multiple myeloma, either immunoglobulin A or immunoglobulin G is secreted. In case of Waldenström macroglobulinemia, immunoglobulin M is produced, and this monoclonal gammopathy of unknown significance, immunoglobulin G, okay, or A, like the multiple myeloma is secreted. Okay, but there is a specific difference we will see. So in multiple myeloma, it is, by the way, the most common primary bone malignancy. Okay, it is most common primary bone malignancy in elderly. Most common primary bone malignancy in elderly. It presents with a chronic lower back pain and elevated serum protein, typically of more than 8.3. Its normal range is from 6.0 to 8.3, which is the normal serum total protein. But in case of multiple myeloma, it should be elevated, okay, because it secretes protein, okay, specific monoclonal protein. So these two important chief complaints plus, okay, this important clinical features plus weight loss. Okay, unquantified or significant weight loss and fatigue should be there. And most importantly, hypercalcemia. So lower back pain with hypercalcemia. Always an elderly patient, always consider multiple myeloma. So hypercalcemia, more than of 10.5 milligram per DL. Renal failure. Okay, so in the in the above question, the serum creatinine, okay, the serum creatinine was 1.5 milligram per day. So it's elevated. So what explains this? If you consider the diagnosis is multiple myeloma, then you should answer it. It is due to a Bence-Jones protein. So the type of protein, okay, either it's okay, an aggregate of these immunoglobulins that go, okay, in the kidney, okay, that go in the kidney. Okay, so it is Bence-Jones proteinuria. Then it will damage, it will deposit there, and it will damage the tubules. So it will cause renal failure. Okay, renal function derangement. Good. They will have osteolytic lesions on the lower vertebrae. So typically osteolytic. Okay, on the X-ray it will show lucency. In the X-ray it will show lucency. Okay, lucency on the X-ray. ሶ ኦስቲዮሊቲክ ሊዥን በማምጣት የሚታወቅ ግን ደግሞ ኤሊቬትድ ሰረም ፕሮቲን የሌለው ሌላ ኮምፒቲቲቭ ዲፍሬንሻል ዲያግኖሲሳችን የሚሆነው ሜታስታቲክ ቦን ቲዩመር ሰከንደሪ ቱ ፕሮስቴት ካንሰር። ሶ ዲስ ኢዝ አን ኢልደርሊ ሜል። ሶ ፕሮስቴት ካንሰር ካለው ሜታስታሳይዝ ያደርጋል። then it will present with a similar picture or profile like a multiple myeloma, but you have to assess that for the prostate cancer. You have to think of the lower urinary tract symptoms. Okay, prior history መጠየቅ መቻል አለበት, and other investigation should be done. Good. So the cause of death in multiple myeloma is not the cancer itself, but it is the infection. Okay, infection is the cause of death. Why? Because it is a monoclonal. That means it has only one antigenic, specific antigenicity ብቻ ነው ያለው ማለት ነው። Okay, due to monoclonal antigenicity. Monoclonal antigenicity. Okay, it's due to monoclonal antigenicity. እነኚህ ኢሚኖግሎቢኖች ብቻ ነው ስፔሲፊካሊ የሚሰሩ። ስለዚህ የተለየ አይነት አንቲጂን ካለ they may be weak for that. So infection is a cause of death in multiple myeloma. Good. The second one is Waldenström macroglobulinemia. So it is a B-cell lymphoma. So it is a blood cancer, lymphoma, B-cell type, and specifically producing monoclonal, what type of immunoglobulin? Immunoglobulin M. Okay, not A, not G, but immunoglobulin M. And this immunoglobulin M is a macromolecule. Okay, that's why we call it macroglobulinemia. Macroglobulinemia is a macromolecule. It causes a significant amount of viscosity or hyperviscosity within the blood if it is secreted in a significant amount in case of this B-cell lymphoma. So this patient present maybe with lower back pain, elevated serum protein, okay? And you will see specifically elevation of IgM by serum protein electrophoresis. So what it differentiates from multiple myeloma? It has no lytic bone lesion. Okay, they primarily present this with generalized lymphadenopathy. Why? Because of the lymphoma, because of the B-cell lymphoma. Okay, and they also present with hyperviscosity syndrome. So this is an acute complication. It should be treated urgently once it is diagnosis is confirmed with plasmapheresis. So hyperviscosity due to the immunoglobulin M macromolecule, and it will even it can even cause significant amounts of stasis within the blood. So it will cause retinal hemorrhage as well as stroke could happen because of the large molecule of molecule of this immunoglobulin M ማለት ነው። The third one is monoclonal gammopathy of unknown significance. So it is just like that of multiple myeloma, that is specifically monoclonally it secretes the cell, that plasma cell secretes immunoglobulin G or A, but there is no CRAB, there is no organ dysfunction. There is no hypercalcemia, there is no renal derangement, there is no anemia, or there is no lytic bone lesion. Thank you very much. If you like it, like and follow.